Hello, welcome to the Beasley Equine Podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. Today, we're going to dive into an AAEP prepared presentation on understanding equine strangles. So stay tuned.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.
All right, I want to start this podcast by just saying Strangles fucking sucks. And it's a pain in the ass for anybody that's ever experienced it. So I hope today you guys get a little bit of takeaway on how to prevent it. And if you're concerned about it, maybe ease some of the concerns and give you guys some information on how to best handle these horses. So we're going to go over what Strangles is, signs of the disease, how we diagnose it, how we treat it or not treat it, how we manage it. We're going to talk about vaccines and also the big thing, prevention. So Strangles is the old school term for the bacterial infection that's caused by Streptococcus equi, subspecies equi. So it's basically a strep disease that's specific to the horses, and there's several of them, and this subspecies, or break it down farther, is subspecies equi, and it's a bacteria that typically infects the upper airway, and you'll get lymph nodes in the head and the neck that get severely inflamed from it, hence the name Strangles. A lot of horses have trouble swallowing, and they can get so big they even have trouble breathing, where they're being strangled. That's where the term Strangles comes from, and it's very highly contagious in horses. Luckily for us as veterinarians and horse owners, it's not generally contagious to people, although it is possible. Where I worked in Texas was basically the Strangles capital of the world, and a tech I worked with, Miss Jolly, if you're listening, hello, she actually got a Strangles infection. They cultured the Streptococcus equi, subspecies equi, from one of her lymph nodes. So it is possible, although not likely. So don't freak out about it, but it is possible. And the primary source of recurrent infections is what we call asymptomatic shedders, which we'll talk about a little bit later. So some of the signs of Strangles, like any other bacterial infection, most of them, you're going to get a fever, typically more than 101.5, which according to the text is normal for horses. So anything over 101.5 and horses that have been exposed, Strangles is definitely on the list. And like I said, it affects the lymph nodes, and there's two main ones that it gets. It gets the submandibular, which sub means under, mandibular is the mandible or the jaw. So the lymph nodes under the jaw, and also the retropharyngeal lymph nodes. Retro kind of means behind, pharyngeals, the pharynx or the upper airway throat of the horse, so behind the throat. So you get enlarged lymph nodes under the jaw or kind of behind the jaw and the throat. And you also get a very purulent nasal discharge, which is like that yellowy, snotty snuff coming out of the nose. And of course, like any other disease that causes a fever and all this, your horse gets depressed. They're sick with this. And because of the local infection there and some of the local swelling, they can have difficulty swallowing. They also can be in respiratory distress because of the pressure on the airway there, and you can get a noise when breathing, also called stridor. Some of them sound like they're kind of like having trouble breathing, and you can see some of these horses actually extend their head and neck, and some of that's just to relieve some of that pressure. And then a lot of the lymph nodes will actually rupture and drain out from the skin, which sounds terrible, but that's kind of what we want in some of these. And the retropharyngeal lymph nodes may rupture and cause an infection in the guttural pouch, which we call empyema. So the guttural pouch in horses, if you're not familiar, is kind of an air-filled space within the head that's like an expansion of the eustachian tubes. And there's a one-way valve in there that you can see scope in the upper airways. And when we scope horses, I always show owners, like, we wiggle their ear, whichever guttural pouch we're in, In the top of the guttural pouch, you can see the base of the ear wiggle in there, and then it also extends almost down to the throat latch there. So it's a big sac basically, and what we think as in the vet and scientific community that these guttural pouches serve to help cool arteries. There's big arteries and veins and nerves that run through the guttural pouch, and we think that big sac with them breathing and the guttural pouch opening actually helps cool the blood as it flows through there and keeps the brain from overheating. So infection in the guttural pouch, obviously the lymph nodes will rupture into it, and then gravity, the pus or purulent discharge can collect in the bottom of the guttural pouch. And then we can also see that that's where some of the chronic carriers come that we'll talk about later. But it's not always just right there. They can also spread to other lymph nodes outside of the head and neck, and which kind of like the cancer term metastatic. We call that metastatic strangles, or also bastard strangles. John, you don't have to beep that one out. That's in textbooks. Bastard strangles is when it spreads to lymph nodes outside of the head or the neck. We've had them bust open in very strange places. One of the other risks and complications of the infection is purpura hemorrhagica, which can cause swelling of the distal limbs, the chest, and everything, and it can even cause pretty sudden death if some of the big blood vessels rupture. They can also get muscle inflammation and pain. The term for that's myositis, or inflammation of the muscles. That's the myo part. Itis is the inflammation. We do see that. The last purpura case we had muscle enzymes through the roof because of the muscle inflammation. And in pregnant mares or mares that have just foaled, we'll see lack of milk production, but a lot of that's just secondary to the fever. So the other complication of these infections are what we call chondroids. Those are basically insipated pus that occurs in the guttural pouch. And insipated means the pus sits in there and turns into hard little stones. And they can sit there, and the horses may not be sick, but can spread the disease because these little stones are in there with the bacteria, and they can shed it. And the only way to get those things out is to use an endoscope, and to get into the guttural pouch, deploy what we call a basket through the scope, grab one, and pull it out all the way through the tip of the nose, and then we go back in the pouch. So this can be some of them will have, maybe even 16 ounce. You could fill a 16 ounce cup full like this solo cup here, and you got to get those out one by one. And most of the horses that we try to get that out can be sick, so sedating them is a bit of a complication. Those are terrible to deal with. The other complications we see, only about 20% of the cases get these, but when they do have them, they'll increase the fatality rate, or the rate of horses that die from strangles, and they require a longer and more intensive treatment. The one we're treating currently was diagnosed just about a week and a half ago, and he's still in pretty bad shape. He's still got swelling. We've got him on antibiotics, high levels of Dex, and we're all a little bit worried about him. And he's one of the few percent that get those complications. So how do we diagnose strangles? A lot of it, the clinical signs are what we see when we look at your horse is highly suggestive of strangles. They've usually been somewhere where they'll get exposed, as a training barn that's had a case, or a high concentration of numbers of horses in a small area, or a sale barn where they're running through like crazy and there's not very good health checks. So a lot of it we kind of know just looking at the horse and the age and the exposure. But to definitively diagnose it, we can do what we call a culture, where we can take a swab in the nose if they've got a lot of discharge, or we can take a sample from a guttural pouch, we can take a sample from a lymph node, or we can kind of wash out the back of their throat and then put that sample on a blood auger plate, which is basically sheep blood, kind of looks like a firm jello, and then we can grow the bacteria and identify it as strangles. The most sensitive way to diagnose strangles is what's called PCR, or polymerase chain reaction. Since COVID, everybody's probably familiar with PCR. That's how they diagnosed COVID. And luckily, thanks to a company called Fluxergy, PCR testing is available in-house at a lot of vet clinics. We have the machine here, and we can swab a nose, and within an hour, we have PCR results, which is the most sensitive results, so we know whether a horse has strangles or not. Instead of sending a PCR off where we got to FedEx it, they do it in a lab, which sometimes they only run these tests on certain days. So this is a shout out to Fluxergy. Thank you for creating this software and hardware, and so we can run this in-house, because sometimes owners don't recognize it. We got a clinic full of horses, or it always happens on a busy day, and we need to know whether it's strangles or not, whether we can even unload this horse and risk transmitting this disease. So now we can go to the trailer, wear our PPE or personal protective equipment so we don't spread it while we come back in, get a quick nose swab, kind of like they did for COVID, and run it in our machine. Within an hour, we'll know whether that horse is shedding strangles. So the biggest diagnostic challenge is what we call asymptomatic carriers. So horses with the chondroids that we talked about earlier that are carriers of this disease but are not symptomatic. So that means the horse is completely healthy. Lenny's taking a drink of water. They're completely healthy, but their guttural pouches are full of these things, and they're just shedding the bacteria, and they can infect other horses. So if you look at the literature, 4 to 50% of horses on farms with recurring strangles are carriers of the bacteria. But that's a pretty big range, 4 to 50%. So anytime we see these recurrent infections, we always worry about what we call carriers or asymptomatic carriers. So with that said, it's a good idea that all horses that have had the infection or signs of it, we look in their guttural pouches. And it's even better if we can get a sample from the guttural pouch, run the PCR, and make sure it's negative, and before we reintroduce those horses to healthy horses. And as far as shedding the bacteria or horses being able to infect other horses, it can occur for weeks to months after infection in a lot of horses. So that's why some of these training barns, that's why it's such a big pain in the ass, is they just keep coming in cycles and waves. And in rare cases, I've seen it where I worked in Texas. There was one horse that shed it for years, and looking back through the history, we figured out that's the only horse that's been here. We scoped him, and his guttural pouches were full of those chondroids, and we had to go in every day for a couple weeks and clean them out and flush them. And it was a very big expense to the owner and a real big pain in the butt for us. So what happens if a vet diagnoses your horse with strangles? The first thing to do is you need to isolate every horse with a fever, because they could potentially be spreading this disease. And the other thing I will urge is do not treat these horses without your veterinarian. And I'll explain why here in just a minute. But if your horse has this fever, maybe strangles, please call your vet. They may not even need to look at the horse. They maybe I'll tell you what to do over the phone. But the treatment is a lot of supportive care, where the lymph nodes are swollen. We'll hot pack them. We'll treat them with Fludix and megalamine, which is Banamine or Bute, and just to keep the fever down. And antibiotic therapy is controversial in these guys. And you may say, oh, it's a bacterial infection, we need to treat it with antibiotics. But that's not always the right thing to do, because any cases that aren't complicated, we don't treat with antibiotics. What we call the complicated cases, if they have trouble breathing, if they get the other things we talked about, like the myositis or purpura hemorrhagica, those do require antibiotics and other treatments. Some of them we even put in what we call a trach or a tracheostomy, where we put in, we basically make a slit in their windpipe below the swollen lymph nodes and put in an opening where they can breathe underneath that. And it sounds crude and rude and archaic and barbaric, but it saves the lives in a lot of these horses. We keep a couple of those things here, and it's kind of only when we have to do we do it. and that's to keep the horse alive till they get to a hospital that's more suited for 24/7 care. If we do use antibiotics, the treatment course usually takes weeks or even longer to completely clear that infection. But early treatment, this is where I was talking about the antibiotics. If you get a horse with a fever and you start treating with antibiotics and it strangles, it may prevent immunity to infection and it may delay the length of the infection. So if your horse has a fever and it might be strangles and you reach right for the antibiotics, a couple things might happen. That horse may not develop immunity to protect itself longer from this disease. And also, sometimes that stuff, the bacteria and the infection will kind of wall off. And as soon as you stop the antibiotics, it comes right back. And a lot of the cases I saw where they bust into the guttural pouches and become carriers, those horses were treated with antibiotics early in disease. So if you think your horse has strangles, call your vet and figure out what's the right thing to do. Strangles is a reportable disease in many states. What that means is if we get a positive, we need to call the state vet. I don't know exactly what the Illinois rules are. We always report it. Nothing usually comes of it. But other states, they can be a little bit more enforceful with that. So, and if you do have a horse with strangles or an outbreak, we just got to stop movement of horses. Don't send infected horses where they can infect other horses, and don't allow new horses to come in where they can get infected. And I've been preaching this for years, ever since COVID. I know we keep bringing that up, but if we would have shut down travel during COVID, I think we could have nipped that thing in the bud. That's the first thing we do with a viral outbreak in horses. If it's at a racetrack or anywhere, they shut down travel. Horses can't leave, new horses can't come in. But we're not on the news every night getting called xenophobes and racist because of that. So anyways, off my soapbox. And also take your horse's temperature every day. Like normal can range from, according to the text, anywhere from 99 to 101.5. 101.5, depending on the ambient temperature or the environment, is a little bit high on most horses. So if you do have an outbreak, isolate those horses at the first sign of fever, which sounds like a great idea, but not always practical. I know if I've only got 3 horses at my house, but if I had one that had a fever, I suspected strangles, I would not even be able to isolate it right now. So it's a good idea, but sometimes it's not that practical. And know that infected horses can transmit the bacteria to healthy horses 1 or 2 days after the onset of fever. So that's why as soon as a horse has a fever, you need to get that away if isolation is possible. And a lot of hospitals have what we call an isolation ward, which is stalls in the hospital that's completely shut off, different air, different everything, to where they won't spread the horse. And to go in and out of the stalls, we have to basically cover ourselves head to toe, and then shuck those coverings, and then disinfect everything before we go anywhere else in the hospital. And also, we do those horses last. We have to treat them, whether we're scoping them or anything, and that way we can disinfect everything at the end of the day and make sure we don't accidentally transmit it to healthy horses. So if you're a trainer or horse owner with several horses and you do have an outbreak of this, what we recommend, which is not always feasible, is to create 3 groups of horses. You got your infected horses, horses that have been exposed, and horses that are clean with no exposure. And we want to make sure there's no nose-to-nose contact, because that stuff they're spraying out of their nose or even breathing can infect the other horses, but not just nose-to-nose. Anything the noses can touch or the lymph nodes can also spread it. That's feed buckets, that's water buckets, that's halters, that's lead ropes, that's bits and bridles, anything you can think of, brushes even. So you got to be very careful with that. And then the clean horses with no exposure should be housed separately in an area where infected horses have not been. And like I said earlier, when the hospital settings, we do the strangles horses last. On the farms, if there's an outbreak, always handle the clean horses first. Clean their stalls first, feed them first, water them first. And ideally, if you have enough manpower, have separate caretakers for the sick ones or the ones that may have been exposed versus the clean horses. Separate cleaning equipment, separate grooming tools, separate water buckets, separate pastures, etc. The best, I mean, pretend it's something super, super contagious, because it is, and everything you can think of to do that. And then if the same people have to work with all the horses, which is like most places, dedicated protective clothing must be utilized. You can get some disposable gowns online. You can get coveralls, and just always wear gloves, boots, gowns, and just wear them in those areas. And we can disinfect equipment between horses, like even pitchforks, brushes, tack, everything. Read, if you get over-the-counter disinfectants, just read the labels and make sure, especially the horse stuff that's labeled. I mean, Strangles is a very well-known contagious disease, so if you're getting disinfectants, a lot of it will say how to dilute it to a dilution that will kill the Streptococcus equi or Strangles. So when I say protective gear, a lot of it's, coveralls, boots, gloves, maybe a gown. You don't have to like wear the whole face shield or, something that looks like a scene out of Breaking Bad, but really take care of yourself. Because, I mean, if the horse blows, if their nose is full of snot, a lot of them blow, and you can get, even if it's not, you don't see it on you, you can be carrying that bacteria back and forth, because people and equipment can transfer this infection. So be very wary of yourself. Disinfection and hand washing, very critical. So super careful going between infected horses and non. If you can, do those horses either first thing in the morning, change clothes, shower, disinfect yourself, and then go to the healthy ones, and then do the sick ones again at the end of the day. Water and feed troughs should be cleaned and disinfected daily. And sick horses and non, and the stall should be cleaned after the manure removal. So some of the disinfectants, like I said, there's a lot of commercial products, but 10% bleach solution works really good for these. And the other thing that kills this bacteria really good is sunlight. So what we'll recommend here is, after you disinfect everything, if it's in the summer with the hot months, take the feed buckets, the halters, anything that has come into contact with these sick horses, disinfect it, and then put it out in the bright sunshine where no other horses will come, and let it dry and let that sun bake that bacteria and kill it. The manure and wasted feed should not be spread in pastures either. That's something else to think about. You need to basically find another place to pile this manure and let it compost in an isolated location. And if you use a pasture for isolation, or if there was a pasture where there's infected horses, you need to keep those clear and rested for about 4 weeks to let that bacteria run its course and kill itself out. So if you had Strangles horses in a pasture, wait at least 4 weeks before you turn another horse out there that could become infected. So we always talk a lot about vaccinations and how great it is. So we don't really vaccinate during an outbreak. It's kind of a little bit like shutting the gate after the horse has already got loose. But there is some other things we can do. MG Biologic, which is a company that makes plasma. I just heard about this a couple months ago. They've got a plasma now that's super concentrated with antibodies for Strangles. I haven't used it yet, but I'm going to order some and keep it on hand. So vaccination is a method for prevention and control, but it doesn't always guarantee. It's not very good in horses, in my opinion. A lot of the horses we saw with bad Strangles in Texas had been vaccinated. With that said, we still use it. We still believe in it because it might reduce the severity of the disease if your horse has had the vaccination and they do become infected. But talk to your vet a little bit more if you're kind of worried about your horse, and a lot of it depends on where the horse is going, where it's been, the age of the horse. A lot of horses that have been in training have been exposed to it, and a lot of them have natural immunity to it. And there's a couple different vaccines that are available. One of them is intranasal, which means in the nose. We squirt a vaccine up their nose, and there's one we give in the muscle. But you got to be very careful when you give these things too. With the intranasal, you got to make sure it gets where it needs to go. If the horse is throwing its head and you don't get it in there good, it's not going to be effective. And then we can also see complications at the injection site. So we got to handle these vaccines with a lot of care. There's been a few cases of accidentally causing abscesses from the vaccine itself. Intranasal probably provides the best local immunity as far as protecting that horse when it would breathe it in. So we don't vaccinate during an outbreak or immediately after a clinical infection. And that goes up to about a year. If a horse has been exposed, we won't vaccinate again for another year. And once recovered from an infection, at least 75% of these horses will have immunity for 1 to 2 years. There's some antibody testing we can do to help determine better timing for vaccinations with horses that have been exposed or have experienced that purpura hemorrhagica, that serious side effect. And that's the purpura hemorrhagica comes basically from an overactive immune response to the disease. So it's not so much the bacteria that's causing the trouble, but it's the horse's own immune system. And we'll see a lot of swelling in the limbs or the legs, the head, the neck. You can get hemorrhages in the gums. You can get a fever from it in the chest. And they can get pretty sick from this and even die. So purpura hemorrhagica is a pretty serious side effect of strangles. So who do we vaccinate? We usually only recommend vaccinating healthy horses that have no fever or nasal discharge and horses who have not experienced an infection within the previous year. And horses that travel routinely and are exposed to various horse populations, those are good to vaccinate. Like I said, it's not always effective, but if they do get exposed and infected, the severity of the infection is decreased with the vaccines. And brood mares prior to foaling, if there's a history of strangles on the farm, it's good to vaccinate those prior to foaling, and then the foal will get some immunity through the placenta and through the colostrum. So with the strangles vaccine, the initial vaccination requires a booster. It's not a one and done. Some of the intramuscular is a series of 3. I think the intranasal is a series of 2 to get the immunity up that we need. And that immunity can take 3 to 4 weeks to develop. So if your horse is getting ready to go to a trainer next week, it's a little too late to vaccinate for strangles. When you do it at least a month ahead of time, so leave enough time before transport to shows or trainers or anything like that. And consider the chance of exposure and your comfort with the level of risk. Like I said, the vaccines are not always effective, and there's a little bit of risk with them. So if you have not had strangles on your farm, you do not want it. Trust me, ask any trainer or farm that's went through an outbreak. So one ways we can prevent strangles coming in is if you have horses coming in, get a health paper, make sure a vet has taken his temperature before they come. And health papers we won't get into them, but around here, health papers are good for 30 days. So if I look at a horse today and he's completely healthy, he may get exposed to strangles tomorrow and go somewhere in 2 or 3 weeks and be a carrier, even though he has a good set of health papers. And this isn't always ideal in a training situation, but if you're buying a horse or you have time, if you get a new horse, if you have a separate place to keep them, isolate those horses for 2 or 3 weeks and check their temperatures every day. The 2 or 3 weeks timeline comes from the incubation period, or what that means is basically the time your horse gets exposed to the time they're actually sick. So if you got a horse by itself, a new horse in isolation, if he's been there for 3 weeks and he hasn't got sick, odds are he's not going to get sick with strangles. And also ask the owners about the history of strangles and vaccines and testing, and just kind of keep your ears and eyes open. You know, if you got a horse coming in that may have been somewhere that's been exposed to strangles and could be infected. The additional preventative measures you can take with these guys is individual water buckets for each horse and disinfect them daily. And it may take 1 or 2 buckets for each horse. That way you can keep one full and the other one disinfected, maybe in the sunshine if it's in the summer. And if there's a shared water source, disinfect that at least weekly or as often as you can without keeping the horses away from water. And if you're traveling to shows, which a lot of our clients do, a lot of you horse people do, bring your own feed buckets, bring your own feed, and bring your own equipment to try to minimize that share between stalls and pastures. And you can also, this is typically a young horse disease, although we'll see it in older horses, but you can group horses and pastures according to age. Keep the young ones together away from the middle-aged or older ones. So Strangles is scary. It sucks. I hate it. But there's some things we can do as veterinarians and horse owners to reduce your horse's risk of exposure and with good management and clean conditions. And definitely involve your vet if you suspect an infection, because it might not be strangles. It might be something that we do need to intervene with quicker and not just do supportive care. Isolate and contain the sick horses. And if you picked up any 3 things from this podcast, number 1 is disinfect, number 2 is disinfect, and number 3 is disinfect. Disinfect, disinfect, disinfect. And I'll say it one more time, disinfect, because that's one of the best ways to keep strangles from spreading. And we'll do a later podcast that will dive in a little bit deeper with strangles and get some numbers from current research. But as far as that goes, I hope that gives you a pretty good understanding of equine strangles. Not to scare you guys, but it definitely needs to be on your radar as horse owners. So thank you guys for tuning in. And until next time, keep your horses and yourself healthy.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank